She is a shrewd administrator. She is an organizer who knows how to get the job done. Her husband, the President of the Republic of Ghana, is an inspirational leader and an extraordinary motivator. Together, they are quite a team. While pressing demands of the presidency takes the president mostly to the formal settings, she has been providing the balance, attending to the miscellaneous masses in the backstage. Though not in the front lines of politics, the rays of her light are those illuminating the foreground. Her Excellency the First Lady of Ghana, Mrs. Lornida Mahama, is a wife, a mother, indeed mother of the nation. She leads her NGO, the Lornida Foundation, and is a prominent player in the affairs of African First Ladies. She had been active in social work, even when her husband was a member of parliament, a deputy minister, a substantive minister, and a vice president of the Republic of Ghana. Past activities which have honed Mrs. Lornida Mahama for the greater responsibilities of the present. Prior to her latest operations under the Lornida Foundation, Mrs. Mahama had extensively indulged in philanthropic giving through the then alternative source of income program she pioneered. The journey began with donation of medical supplies to hospitals. Members of parliament received their share and distributed them to the medical facilities within their constituencies. Mrs. Mahama, a premier ambassador of the UNAIDS on the prevention of mother-to-child transmission of HIV/AIDS, she has organized a number of advocacy and sensitization programs. In her quest to help achieve an AIDS-free generation in Ghana, the First Lady has been pushing for preventive treatment. Is 4-5 times higher. At the First Ladies Fora, the women were given all the tips needed to give a healthier lifestyle. The multiple screening and tests conducted on them is a wake-up call to medical institutions to operate one-stop shops. This is one of the platforms for awareness creation, where underprivileged women are taught to look out for symptoms of all kinds of ailments. She has also presented 40 boxes of food supplements to the National Association of People Living with HIV/AIDS. Persons treated as outcasts are embraced by the Lornida Foundation. Orphans, widows, disease-stigmatized persons, the physically challenged, the visually and the hearing impaired, and other groups with special needs have all had their lives touched one way or the other by the foundation. In the days when she operated under the alternative source of income program, the First Lady actually adopted specific orphans to care for them. Metamorphosing into a foundation, assistance for orphans reaches out to clusters.
I'm happy to say that Her Excellency, Mrs. Lornida Mahama, has been of tremendous help to the home.
1, 2
It took us by surprise when about 9 years ago she came with her NGO to donate items to the home. We didn't request for, but we were in dire need of items. This is a home that we all know is under the jurisdiction of the Department of Social Welfare. Therefore, it's a government institution, and it was built in 1962. That's why we were very happy, and we were privileged to have had her to be a donor for the home. Most of the items donated were consumables. You know, the home has a wish list which we present to donors. And most of the expensive ones on the list are projects that we feel would enhance the care that we give to the children. And then things like diapers, baby formula, disinfectants, fruits, anything at all that goes into the care of a child. And she most often provided most of these items. Then we also approach her after the donations to enhance the care of the babies unit. And she facilitated the building of this new structure that you are seeing behind you. Apart from all these things, there have been times that she has spent her birthdays with the children, thrown parties for them. She's even thrown a party at her residence for us, and she and the husband served the children. They danced, played, and they were very happy. They see all these things as memorable occasions in their lives. And then occasionally she also supported the staff to motivate them to give proper care to the children.
My name is Catherine Akujira. I'm the Deputy Director for Nursing Services for Osha Polyclinic. The First Lady brought us a lot of items to run the facility. And some of the items are syringes, gauze, suction pumps, diapers, toothbrushes, cotton wool, and a lot, to mention a few, a lot. In fact, some of the clients coming in, they don't have money. Looking at the sub-metro in which we are living, they come, and if you ask them to, some of them also don't, they haven't registered with National Health Insurance. We know that National Health Insurance is free. They pay their premium. When they come, we attend to them. But some will not register. Some also come with expired cards. So when you ask them to pay, it becomes a problem. But with the logistics that she brought, we're able to use some for the clients who don't even have money. So it's very good. And we thank her so much.
The orphanage in Tamale, capital of the northern region, is another such home strapped against the Lornida Foundation. Same treatment as Osu, with a new structure sponsored by the First Lady under construction.
One of her visits to the home, she got to know how we are finding things difficult in the old block, and she decided to put up a new one, which is going to be a store building to accommodate the children, and it's going to go a long way to help us. The rooms in the old block are very small, and this one will be very spacious for the children and will also help accommodate a lot of children. She's been coming here, I think, since she was the second lady, and whenever she's around, she helps us a lot. And she's been giving us money, donating food items, and even giving the staff parcels in the form of clothing and other items. So she's helping the home a lot, and we appreciate that. And we wish God blessings on her and the family.
Likewise, Amfani Children's Home, a Cropon school for the blind, and the Christ Faith Foster Home received clothes, assorted food items, electronic products, plastic products, fabrics, among others. She currently supports 7 orphanages in Ghana, 2 each in Accra, Tamale and Techimai, and 1 at Nkoranza. Across country, 3 regions comes under her ambit, and these are the Brunafo region, Greater Accra region, and the Northern region. Some of the First Lady's dramatic success stories are found in the area of women empowerment, taking cognizance of their specific health needs. Her Excellency the First Lady has been supporting the Gambaga Witches Camp at least twice a year with foodstuffs and other personal effects.
Here on behalf of Her Excellency Mrs. Lornida Mahama, together with officials from the Lornida Foundation.
She is currently facilitating a modern hostel and a vocational training center for the supposed witches with the assistance of Get Fund. Her office collaborated with a US-based NGO to organize free medical screening for the mothers and their families at the camp.
I was accused as a witch, that I bewitched one man, and I was seriously beaten and brought here. When they accused me, what I said was that, in fact, I'm not the one responsible, because I am not a witch, and I think I'm not. So they started beating me, and I said, well, if you can kill me, I'm ready, but I'm not a witch. That was what transpired.
The entire Gambaga community benefited from the medical outreach. Her interventions at the witches' camp, considered by the government of the United States as a feat, was cited in a State Department 2012 Human Rights Report. Perhaps it was an act of God when Ghana's First Lady met with a US-based non-governmental organization called MedShare on the sidelines of the 68th session of the United Nations General Assembly in September 2013. MedShare distributes surplus medical supplies and equipment to underserved healthcare facilities in developing countries. She was able to connect MedShare to her objectives based on her efforts to make healthcare accessible to all in Ghana. In particular, the First Lady drew attention to child mortality and maternal health, an area in the UN Millennium Development Goals Ghana was struggling. So, MedShare USA supplies the Lornida Foundation with medical equipment and material which she procures with help from sponsors.
Doctor, special greetings for the First Lady of Ghana.
Thank you so much.
The key moment was this. Precisely on November 14, 2013, MedShare held a charity gala in New York to which the First Lady of Ghana was invited. She delivered a thought-provoking speech which eventually led to significant support from the donor community in New York. Evidence of the enormous work being done are the contents of this warehouse, where items are catalogued before distribution to distressed hospitals and clinics. And as the program's officer of the Lornida Foundation describes, the list on both sides, items and recipients, are endless. Once a consignment arrives, a task force from the Lornida Foundation goes to the ground, using a carefully drawn criteria to select the beneficiaries. Elembele, Diskov, Aflao, Damango, Tamale, Apam and Kede are some of the towns which have benefited, reflective of a nationwide tour. Similar donations were made to the Sogakope District Hospital in the Volta region. Some nurses of the hospital say her donations made a difference.
I was around when the First Lady came to visit us, and to my surprise, she brought us syringes, gloves, gauze, and it was so useful to us. So I just want to thank her so much, and we are so grateful for what she has done, and we expect more of her.
The First Lady being here to give us some support with donations has really helped a lot.
The West Gonja Hospital at Damango received 38 items from the Lornida Foundation on the 14th of May 2014. The consumables are gone, but items like delivery beds donated by the First Lady are just making wonders at Damango. The hospital recorded just one maternal death in 2014. This hospital has been given additional facilities, oxygen generating plant, an incinerator, a morgue, an operating theatre, walkways, etc. While the government provided these, there was still a huge void which the First Lady is bridging.
Midwives these days, they are very scarce, and the midwife we have in this hospital, they are very old, so they used to deliver from low delivery beds. But now that these beds came in fact, they stand comfortably and deliver women, and the women too, they enjoy lying down at on a comfortable bed and deliver. Some of the delivery items that we are very much grateful with were the delivery parts, and then the equipment like artery forceps, then there are certain forceps and all those things that they use to deliver. So now they make them into parts, and each part is used for one woman in delivery. For that matter, I must say it has given us a very good delivery system in the hospital, and we are grateful about that.
The hospital already had a malnutrition project that was being undertaken. And when this donation came in, it went a long way to boost the morale of this project. Some of the children who were already being managed under the malnutrition project had additional food supplement, and this went a long way to help in their recovery.
We are privileged as an institution because the president was born in this hospital.
So far, Mrs. Lornida Mahama has assisted no less than 15 students with Chinese scholarships and countless number of scholarships through other sources. This covers tuition, boarding and basic operating costs for needy pupils and students. Some basic schools also received books, teaching and learning aids, interactive toys to help in the early childhood development. The First Lady has used her good offices in promotion of the girl child, triggering or dovetailing the discussions in their interest. Mrs. Lornida Mahama has been recognized by 3 important constituencies: her local community, at the national level, and by the international community. She was installed as Sumpahima of Nkuranza traditional area. She has been installed as Development Queen or Nkosiohima by the chiefs and people of Bodom, Ampoma, and Angloga, a suburb of Kumasi, Ghana's second capital. Other awards to the name of Ghana's First Lady include those for her campaign against cervical cancer and cervical cancer advocacy received in Maputo, Mozambique and Windhoek, Namibia respectively, an honor for dedicated service to humanity by the state of New Jersey and city of Newark in the United States, and another by the state of Georgia and Maryland for her work in empowerment of women and support for children in deprived communities. Early in 2015, Mrs. Lornida Mahama was elevated to the substantive position as the president of the Organization of African First Ladies Against HIV/AIDS (OFLA). Her inauguration in Addis Ababa in August 2015.
It is a great honor to be elected as the new president of OFLA. I am grateful for your vote of confidence. I accept the great responsibilities that comes with this position, and I am also prepared to take up the challenge to ensure that our visibility is increased across Africa and the rest of the world.
She received the Global Inspiration Leadership Award at the Africa Middle East Asia Summit in Dubai, where she was also inducted into the Global Women Leaders Hall of Fame. Again, she was singled out for commendation by the U.S. State Department for assisting more than 200 alleged witches in northern Ghana.
Working with partner organizations, the Foundation has provided funding and supplies for orphanages and medical supplies for hospitals, and offered scholarships that enabled financially needed Ghanaians to study in China with support from the Chinese government. Lornida also launched a campaign to prevent mother-to-child transmission of HIV and arranged for free immunizations against human papillomavirus to prevent cervical cancer in pre-adolescent girls.
We, the President and Trustees of Fordham University, in solemn convocation assembled, and in accord with the chartered authority bestowed upon us by the Regents of the University of the State of New York, declare Nana Lornida Dramani Mahama, Doctor of Humane Letters honoris causa, and that she may enjoy all the rights and privileges of this, our highest honor. We have issued these letters patent under our hand and under the corporate seal of the university on this, the 16th day of May, in the year of our Lord, 2015.
Going forward, the Lornida Foundation plans to run mobile clinics. These will be positioned in deprived urban communities and rural areas, a way of sending medical services to underprivileged societies with no or little access or motivation to undertake health checks. In all, there are 10 sponsors driving the Lornida Foundation: Huawei, Chinese Ambassador, MedShare, Masada Roofing Investment, WLF International Company Limited, Prime Metro Properties, Tanfield Limited, Drill Masters Africa Limited, Lake Forest Rental, and Helping Africa Foundation. Her works have acquired depth and resonance.
She is a remarkable woman whose heart is in the right place, who is in a position of authority, and she understands that to be an opportunity for service. This great lady is a giver, not a taker.